Welcome back again to this episode 2, where we are still continuing with physical therapy Gursh and Dr. Paul. Now, this episode we are going to focus on misconceptions about injury. What people think should happen when you come to the gym. Is there any likelihood of injury here compared to the sports world out there? Let me start with you, Paul. Do you ever deal with clients who have come to you before an injury, or is mostly after an injury?
In my line of work, it's mostly after they get injured. That's when they come to visit me. But every now and then, because I see a lot of sports people and physically active people, sometimes I get clients who just want advice, especially the elite ones. When they get an injury and it takes them out of the season, so they want to come and learn what they can do to prevent an injury from reoccurring later on.
Okay. What about you, Gursh?
Honestly, I think a physical therapist is known as to see a patient after. No one ever thinks of seeing us. No one ever thinks of seeing us before. And all these injuries are mostly occurred. It can be a sport activity, it can be the gym. And I think if I say 90% of it is a lot of the gym, especially with deadlifts. I think deadlift form is wrong. They come with disc bulges. I don't know if you see that. Chronic pains going down. And then now we teach them preventative care. So they're afraid to go back to the gym thinking that, oh my God, if I lift, I remember that 25-year lift I did is what caused it.
Yeah.
But, medicine has changed. So a lot of people today onwards, we have to learn that even if we're injured, we learn to treat it there and then.
Yeah.
And a lot of us human nature have this thing of leaving it up, it will heal. Like you said, Dr. Paul, you just mentioned to me, you have a lingering pain here.
From one and a half years.
Exactly, which you shouldn't.
So this I remember you got when you were doing snatch. It was a snatch. You were doing snatches, yeah.
Yeah.
I think I was tired.
Yeah.
I was tired and I pulled my elbow.
Yeah.
So I was trying to get to the end of the rep scheme and then just felt a sharp pain.
So even just talking about that, you were an orthopedic surgeon. Why did you choose to come back and you've done the same movement again?
Yeah, you see, exercise can also be curative. You can actually get better from an injury by doing exercise.
Correct.
And it's not just about going to the doctor and maybe getting something fixed.
Yeah.
Exercise is actually a very powerful way of treating injuries.
It's healing. Yeah.
And I know that very well, being somebody who deals with sports and physically active people.
Yeah.
So for myself, I took 2 weeks out. Then I came back. I actually did what they say. I practiced what I preach.
Exactly.
So I just made sure that I kept warming that area before doing anything that involved overhead movements.
Yeah.
It has been getting better with time.
One of the things I tell people, in fact, there is a group of physiotherapists who use functional movement. One of the movements they use is the overhead squat.
Yeah.
And they use an overhead squat and they work with sports teams to see whether they lack range of movement. Because the overhead squat is one of the biggest exposure of what we lack in terms of range of movement. Not really strength,
right.
Because you can just be given a 10 kg bar and not be able to execute that movement. So what I usually tell people is that functional movement, sometimes you might come and work out and leave feeling pain.
Yes.
But it is because of a pre-existing. Maybe it's because of how you're created. For example, your morphology. If you're mostly prone to internal rotation and you do a number of squats, you might leave the box, feeling some pain in the internal area of your knee. I remember we used to have a client who still has one short leg. Yeah. So when doing squats, his form was nearly perfect. Neutral spine, knees, tracking toes, like everything is so good. But every time in between, during squat, just a sharp pain in his SI joint, and he would leave not being able to walk, and I would wonder what's happening. So he hadn't written on his waiver form until he mentioned. And then I realized is that he's squatting now with something heavy because he was strong, with already a hip shift.
A hip shift.
So which is coming now to his pelvic bone, to his backbone, which is,
And that's what I do. So I do something that adds up.
hip shift, yeah.
Exactly.
Yeah.
So, everything in my PT treatment relates to things that are connected.
Yeah.
So the fact that he has had a hip shift,
Yeah.
he's able to do a movement when one muscle is shortening, but one is extending, but there's compensation.
Exactly.
So we try and find where is it not in the right place, or where is the tension pulling, so that we can treat.
Yeah, exactly. In fact, so maybe he had a tilt of the hip.
Hip, yeah.
But now you see, that exposed something he had. Yeah? That now, do you come in and work out with a long sole shoe? Not really. There are ways around it. Now you can outfunction that bad structure. There's a way we can work around it and strengthen those joints. You see? So sometimes you can be discouraged and leave here feeling, that's not for me. I'll never do this movement again. But you see, it's not really the movement. It's you who's coming in with some
motivation,
or some pre-existing
pain,
that or just how you are,
or you
now gets
been
exposed.
injured. Yeah, you've already been injured.
Yeah.
So I had a client that I saw who they pulled up a muscle literally like this, and when I explained that the shoulder has different mobilities, and because you are only strengthening the one plane. Yes, unlike we had to focus in these many planes.
Yeah.
So the body has never experienced that.
Exactly.
So exercise has to be all round.
Yeah.
You don't focus on exercises like, just as in front and back. Yeah.
So what happened to this client? What was it?
So practically what they used to do a lot of bench presses, right? So bench presses is working with the pectoral muscles. So you see, when you're strengthening one particular muscle for so long, but you've never stretched it, but then now suddenly you're doing another movement that has it's going to pull.
Yeah.
It's going to strain.
Yeah.
But the pain was not on the pectoral.
Yeah.
The pain was literally on the trap.
Yeah.
Yes.
So he hadn't torn anything. It was just.
He hadn't torn. It was just a muscle. He had just strained the muscle.
Okay.
The point is, what I'm just trying to say is that, you see, he continued to do that movement. So now he's in no pain.
Yeah.
It's because we
new to his system.
it was
never
new.
experienced.
Yes. So
Work some muscles.
Exactly. And we opened up the trigger point for that muscle, so it could allow some more blood flow, and he could strengthen that muscle now.
And there are times where some movements are not best for everyone.
Yes.
If you come in with already a shoulder problem, we won't give you keeping. Come with a knee problem, we want to ask you squat until your hip piece is below your knee. So it really depends also on the coaches. Yeah, we have a responsibility on how we are going to help our clients get to where they want to get, whether they have a competition, whether it's just general fitness, range of movement. We have to know exactly what to do. I always I gave this example where I learned from a guy called Jordan Charlo, where we say, imagine me wanting to shoot Paul. Okay, I don't want to shoot you. But imagine if I had a gun and I want to shoot you. If I just do this, I'd still, if I'm off by a couple of degrees, I'll still get you. I'll still shoot you. Right. Yeah? Relate that to a squat. You're squatting with both feet on the ground, right? There are so many things that can get out of way.
Center of gravity.
You could be lacking, but you'll never see. But now imagine me walking like 500 meters away, and then I aim at you. If I just move this way a bit, it will miss you by far. So that's a lunge. Yeah. So a lunge will expose so many things that I would not have seen by you doing bilateral movements. So 2 feet or 2 hand movements. So I call those gatekeeper exercises. We all need to have some exercises that we do every time, every so often, to show us, are we going towards the wrong direction? Do we lack this range of, do we have imbalances, front versus back, and such kinds of weaknesses and so forth?
Yeah. So I mean, the other misconception with the being physically fit is people think that physical fitness is all about building muscles and looking good.
Oh yes.
Yeah, that's actually not true. There's a lot more that goes into being physically active.
Yeah.
There's a lot of people forget their back muscles, like you mentioned.
Yeah.
Somebody who had pulled their traps.
Yes.
Yeah.
And probably they had been disregarding training the traps.
Exactly.
And we call these muscles behind here the anti-gravity muscles. They're the muscles that prevent you from falling over.
forwards, yeah.
Like if you're walking and somebody pushed you, the anti-gravity muscles are the
Pull
ones
your back.
That pull you back.
pull you back. So, and those are so important to not disregard, not forget to stretch and warm, and also just in as much as you want your biceps and your pectoralis muscles to look good, then you also need to do something about your back, the anti-gravity muscles.
So, Paul, you're a parent. Yeah. Gursh, you're a parent. Yeah, you're a mom. What do you? Because I feel there is a lot of is it misconception of low tolerance of injury? I think we should expect that there is a chance that it might happen. So if you take your kids to any sports, whether soccer, rugby, whatever it is, in fact, you'll even buy protective gear so they don't get injured. You already know going in that there's a chance of injury. But for some reason in the gym, because it's people see it as like a fitness place that is so whole, and that if I get injured, something went wrong. You didn't do, like, it's a coach's fault, or you should never get injured.
Or I picked up so much weight.
And even if I do, I should never get injured. Especially, okay, for us as individuals, but more so now for your kid. Those coaches or that gym or this and that and the other. So what's your take on, because I think there should be some tolerance, because there is risk, just to be honest, there is risk. When for example, Gursh, I remember when you were jumping on this specific box.
Yes. Yes, this specific
inside, you missed your step.
Yes.
And you fell.
And I fell down.
Yeah.
And I remember hurting my coccyx bone.
Yeah.
But I kept stretching it.
Yeah.
And I figured it strained me all the way back to my hamstring.
Yeah.
But I kept stretching it.
Yeah.
And I tried the box jumps when we were having the mid-year competition. And I was able to do it, maybe not in that much repetitive, but I was able to do it.
Yeah.
Yes, you do get a phobia. I'm not saying you don't, because I think as we grow older, less injuries are better than having more injuries.
Yeah.
But I also say this, I don't know if you guys say this, but when you're young and if a kid falls, it's okay, just get up, you'll be okay. Yeah, I feel like that is what builds their strength.
Yeah.
So having all the time to, especially when you're keeping for kids that you're talking about protective gear, when you're locking joints, I feel there's more prone to injuries.
Yeah. What do you mean by locking joints?
So if you're having the braces, when you're having the protective braces, so you can have the knee braces, you can have the elbow braces, just a strap. Yes, some of them you make sure you don't get hurt, but obviously you don't want to get hurt to that extent where you're getting surgeries and fractures. Obviously not. The point is, what we're trying to say, these injuries allow you to become more stronger. You strengthen.
Yeah.
And even whether it's sport or whether it's here, I always encourage exercises.
Yeah.
So whatever kind of sport it is, whether your child is playing outside or you're taking your child to the gym, these exercises increase mobility, circulation.
Yeah.
And so, for example, I used to see a lot of younger kids when I was training in Nairobi, and all these kids used to come in with ankle sprains, mostly from football.
Yeah.
And the kind of expertise that I work with is more trigger points. Yeah. So I used to release the ankle and the calf muscle, because definitely either their calf was tight or the ankles were tight or the foot was tight, because, kids have growing feet. And due to that, the pressure and the compensation would be straining their ankle. And that's how kids get injuries.
Yeah.
And so it's here, whether we're young or old, the point is that you're prone to an injury maybe because of a past injury, or you're doing it in the wrong form or something. But that doesn't mean the conception of stopping a sport because you got injured. I don't think we should.
Yeah, and also in my practice, I see children also get injured.
Yeah.
So, and a lot of the mothers, they sometimes even they tell me to tell the kids to stop doing what they were doing, and I tell the mothers, no, you cannot do that. That's not the way. Exercise and playing is part of life.
It is part of growing.
Yeah, and it's part of growing. And one interesting fact is that you gain most of your body mass and muscle mass when you're still in your formative years. That's between 12 years and 25 years. Musculoskeletal growth. So those activities that you partake in during that period are so important to gain that bone density and to gain the muscle mass. And actually it has been shown, that has shown that the people who get to their 60s and their 70s and they're still carrying some bit of muscle, they tend to cope much better.
Yes, you're right. You're right. Yes.
Yeah. So I'm of the group of thought that irrespective of injury, when somebody gets injured, we take care of the injury, they get better. But I never stop anybody from. In fact, I encourage them to get back to exercise.
That's why we have preventative care. You know, and the thing is that I feel when you get injured, a lot of us, this is something old school where we never got treatment before. Yes, no, not So we would just tell them, stay for 2 days, 3 days. The inflammation will reduce. We'll put ice. In Indian, we do another wrap of turmeric or something. It will heal, and then you go back.
And dip yourself in hot, salty water.
Yes. But I think if we look at modern medicine now, it's just always good to get checked. Because having injured creates a scar tissue around the deep fascia of our muscle. And that deep fascia, once it becomes tight, as they grow older, unless it's a repetitive injury, it will now cause them the problems that they have. Yes.
And there is injury from contact.
Yes.
But also there is non-contact from you being tight.
Yes.
Coming in tight and trying to do movements that your range of movement can't allow. What do you think of that? What's your take on that?
Yeah, it's actually true. Okay, for us, we look at it in a slightly different way. So, a contact injury will be, for example, you're playing rugby and then you collide with somebody and then your shoulder
dislocates.
So a force is generated from outside and it gets impacted into your body, causing injury. But then there's that injury, for example, a soccer player, they are dribbling towards, they're going to score a goal, and then he positions the foot in a certain manner and twists the other direction. The direction nobody has touched them, and they tear. So that's a non-contact.
Would you say exercise creates like a buffer? Like especially from in fact for both, for non-contact and for contact?
For both. Because you see what exercise does is it improves the functioning of the muscle in terms of strength,
elasticity,
endurance, elasticity,
tone,
and also flexibility for the muscles, and also the joints. Because people who exercise their muscles have the advantage of elongating and contracting
to
full
the elasticity property.
The people who don't do exercise. So then that also has a protective function to the joints. So people who have well-developed, well-functioning muscles, they actually get less strains of the joints.
And I think also stretches helps. Like if you're doing it like from a young, that's why you have young and fit, you know. So I think from when you start from young and you do the stretches, you will avoid people who come into you being that tight and are unable to do certain kind of motions.
So I think there's one hierarchy of development that I really like, and it's, if you look at most fitness regimen, for example, CrossFit's mantra is mechanics, consistency, intensity. So mechanics, think of it of like good technique. Okay, so that's one. There is the guy I mentioned called Jordan Charlo. Is mobility, stability, strength. So you always find that it's as if the prerequisite is mobility. You have to be able to get to a certain position for you to be able to execute that exercise properly. And at that point where you can't because you're tight, then already you're stressing your body, your skeletal system, and the risk of injury goes up. So I think mobility, like you've said, is vitally important. So
it is the most important thing. If your mobility is 100%, less prone to injuries.
So there we have it. It's not that you would get injured in the gym, just like there is a risk of injury outside when playing sports, there is in the gym, but that's not the case. It doesn't mean that it has to happen. Of course, you and your coach, you should lay out the area to prevent the likelihood of injury, and you should be able to execute certain movements before you expose yourself to them. For example, you have to be able maybe to do a couple of pull-ups before you do some keeping pull-ups and such kinds of things. You have to start with a light bar before you go to the heavier bar. Okay, so let's say that's it for this section, and see you now for the last episode, which is episode 3. See you.